Well, speaking of all things health, a new analysis of the Congressional Budget Office's healthcare report shows that 73% of coverage losses under the latest GOP plan, in the Senate at least, would be due to the individual mandate. In other words, taking it away. To former HHS Deputy Secretary Tevi, Tevi, very good to have you back. It doesn't surprise me at all, and you've written as much, that when you take away the mandate, obviously the compulsion, the order to have coverage goes away, so a lot of young, particularly healthy people would be less inclined to seek out coverage. But it's a conundrum for Republicans who end up in the media looking like merciless SOBs, right? So how do they deal with that?
Well, it's never good to look like a merciless SOB, Neil.
Very true, yes. I try to avoid it, but sometimes you just can't help it. You know?
Right. The fact is, this really gets to the heart of what the Affordable Care Act, what Obamacare did, which was it took health insurance and it regulated it, but it also made it mandatory and subsidized it. If you, as you know, if you're going to subsidize something and make it mandatory, you're going to see more of it, and that's why the coverage numbers went up under the Affordable Care Act. What they're trying to do here with changing the ACA, I wouldn't call it repeal because neither the House or Senate bill fully do that, but what they're trying to do is get rid of some of the intrusions. If you get rid of the intrusion of saying there must be a purchase of health insurance by the very virtue of you are alive, a living being, then if you take away that compulsion, then some people will say, hey, I'm not going to buy it. I don't think 16 million people. I think it's too high a number that the CBO put in there, but there will certainly be fewer people.
What do you think it is? And I agree with you. I mean, you just explained it very eloquently, clearly, concisely, that anyone with a brain would hear what he said. Well, of course, if you don't order something, you're going to have fewer people doing it. But it's almost as if Republicans are afraid of their own shadow, particularly those who look more about the CBO reports of the number of people who aren't going to have coverage versus the number of people who are supposed to have that coverage 10 years from now, as if we can forecast that. But they're very afraid of it. What do you tell them?
Yeah, that's exactly right. I think they are afraid of it because they know that people aren't going to look beyond that number of 22 or 23 million, depending on which CBO report you're looking at, 23 million people supposedly losing coverage. Nobody is going to go behind the numbers, other than you, Neil, and me, of course. Nobody's going to go behind the numbers and say, oh, well, 16 million of those are only because you don't have this compulsion written in the law, and if you change this one sentence to say there shall be a mandate, then those 16 million people would be on, according to CBO's analysis. So they know that when the Democratic attack ads come, they're not going to say, well, 16 million of them are because of the mandate. They're just going to say 22 million lose coverage because of those merciless, mean Republicans.
You know, I thought it's easy to play Monday morning quarterback now. But, I mean, when this all started, the idea was to insure the 30 to 35 million, I guess, you know this better than I do, Tevi, who were not insured to get insured. But under the best scenarios, we're still going to end up with a like amount, given the U.S. population growth and everything else, 10 years from now, regardless of what happens, at a minimum. So why did we upend the system for the 30 or so million who don't have insurance for the 300 million or so who do?
Well, that's a great question. And the real answer comes down to politics. It was a very tough, significant, serious point for the Democrats to make in their campaigns in 2008, 2009 about the 47 million or so that they said didn't have health insurance. That was a slightly inflated number, but the fact is that they made that point over and over again. And when you hear in Washington, oh, there's this problem, we must do something about it, right, that's why they went after it. And I think that's what really is the heart of the issue.
And you just said it again, far better than I, far better than any Republican Party. Tevi, the former HHS Deputy Secretary.